Good evening, everybody. I hope I am visible and audible clearly.
Yes, ma'am.
Okay.
Yes.
So I hope all of you are doing fine. And before we start today's session, I would like to just ask whether anybody is facing any problem while submitting assignments or any issues regarding assignments up till now. Okay, I am assuming no issues regarding assignments. Okay.
Yes.
So today we'll be discussing about the different lectures that you people have already gone through in week 5. And yeah, so just for the students who are new to the um, problem solving sessions. So I am Sharmishta Majumdar. I'm a PMRF TA from IIT Jodhpur, and I'll be taking the problem solving sessions for the course Maternal Infant Young Child Nutrition, which is being taken by Dr. Rupal Dalal. Right. So we'll move on to this week's content. So you people must have already, I'm assuming you have already submitted your assignments related to week 5. So we'll be treating these problem solving sessions also as recapitulating sessions. So we will go through So we will go through the topics which have been taken in the lectures related to the science of breastfeeding, the topic on golden hour, and why the golden hour is so important and why colostrum feeding is so important. We will again learn about the comparison of breast milk and the different milk substitutes which are present. We will also practice problems related to breast crawl and how the crawl, whether it differs or not in cases of normal delivery or cesarean delivery. Then we'll see some of the problems based on the Indian law to protect breastfeeding and also about the kangaroo mother care. So, moving on to our first question, which is not a stage of breast milk. So, today I would like you people to just jot down in the chat box the answers so that we have a maximum participation from the class. So, which is not a stage of breast milk? What do you think? What would be the answer? Anybody with the answer? Okay, we have one answer, right? Okay. So, um, Varsha and Dr. Patil says that it is transfer milk. Hitashi also says it is transfer milk. Correct. So, transfer milk is not a stage of breast milk. So, as we know, the stages of breast milk are colostrum, transitional milk, and mature milk. So, if we look here, so these are the different stages of breast milk. So as we can see, colostrum, it is the first milk that is given to the baby. So colostrum is the first milk which is given to the baby, and it's indispensable to the health of the baby, to the growth and development of the baby. So we have been learning it throughout all our sessions that colostrum is very important, and it definitely shouldn't be uh, and it shouldn't be discarded. We have heard about a lot of people um, preferring to feed their babies after delivery honey or milk from different sources, and they also prefer to discard their colostrum thinking it is stale milk. But it is to be again and again established that colostrum is very significant, and colostrum, the occurrence of colostrum is for the first few days, that is from 1 to 4 days. Then we have a phase called the transitional milk. So this phase of transitional milk, it exists from between 5 to 14 to 20 days, and over 20 days, we get the mature milk phase. So, what are the differences between these various stages of breast milk? So, if we see that colostrum is being designated as liquid gold, as it is so important. And why do we say it is gold? Because unlike the different forms of milk that we get in subsequent days of yeah, so we get in subsequent days, colostrum is characteristically deep yellow in color. It is thick in consistency and it is very sticky, unlike the other forms of milk. So, as we have discussed, we find colostrum or the first milk from 0 to 5 days after birth. And if we consider the composition of colostrum, as we can see, it is high in proteins. So, colostrum, the first milk which is being given to the baby, it is high in proteins. And it also has the fat soluble vitamins, minerals, antibodies, immune cells, and different growth factors. So, as we can see, the first milk that we are giving to the baby, it contains or it comprises of most of the nutrients that the baby requires from the first moment. So as we can see, the colostrum also contains antibodies and immune cells. So we have discussed this in our previous sessions as well. What are the important immune factors that are there in the colostrum? And we'll be discussing it in subsequent problems also. So now let us move to the transitional milk. So phase 2 is called the transitional milk, and we can see it from 5 to 14 days or till 20 days also. So usually it is till 2 weeks. So it is thinner in consistency. So whenever we consider colostrum, it is very thick in consistency. But as the phases go on, so the consistency becomes thinner. So the transitional milk is thinner in consistency, and from a deep yellow color, it now turns white. So it slowly becomes whitish in color. So the composition of transition milk is, as we can see, it is high in fat. Unless colostrum, which was high in protein, we can see that our transitional milk is high in fat. It is high in lactose, water soluble vitamins. So we can see colostrum had fat soluble vitamins like vitamin A, D, E, K, which are, say, for example, vitamin D, vitamin K. They are very much important for the newborns. So our colostrum has the fat soluble vitamins. Then comes the water soluble vitamins in transitional milk. Say, for suppose, our vitamins B and vitamin C. So these are there in our transitional milk. And the transitional milk also has an increased level of calories. Now we move on to our third phase of milk, which is the mature milk. Right? So, what we are getting as mature milk is from 2 weeks onwards. So, as we can see, now the consistency of the mature milk has become more watery and less concentrated. So, as we go from the phase 1 to the phase 3 of our milk, we are seeing that the consistency is becoming more watery so that it becomes more palatable for the growing child to have it. Right? So when we consider the composition of mature milk, we can see that they have optimal amounts of, yeah. So the mature milk, it has got optimal amounts of carbohydrates, fat, and proteins. So one more thing that needs to be taken into account here is the mature milk is made of 90% of water. So this ensures that the baby is not dehydrated, and that other 10% is made up of carbohydrates, fats, and proteins. Okay, so now, if we consider the mature milk, so in mature milk also we have two kinds of milk, the fore milk and the hind milk. So the fore milk is the first watery milk which is being expelled out in case of mature milk, and the hind milk is the milk which comes out after the initial release. So this is also to be kept in mind that the hind milk, it has got an increased level of fats. So if we don't give the baby the entire milk, then the baby will be devoid of fats. So it is to be kept in mind that whenever the baby is breastfeeding, so the entire content of the milk needs to be given to the baby. Okay, so Any questions regarding these phases of milk? If there are no questions, then I'll move to the next problem. So, uh, just in case of examinations, please remember the composition of all these phases of milk, because the composition is very much important as to why these will give the specific nutritional adequacy or the nutritional requirement to the baby at each stage, right? Okay. So we go to our next question. The protective effects of breast milk are known to be associated with. I'm sure all of you already know the answer. So if anybody could just volunteer. The protective effects of breast milk are known to be associated with. I hope everybody is not sleeping.
It's B, infection fighting proteins.
Right. So it's B, infection fighting proteins. So what we are talking about, yes, B. So what we are talking about is the immune system, right? So as we know that the mother's blood already has the immune factors. Say for suppose the different macrophages and the lymphocytes, the type of WBCs or the white blood cells, which they are the defense soldiers in our body. So whenever there is an acute inflammation in the body, so the neutrophils take over, and whenever there is a chronic inflammation or a chronic disorder state in our body, so the macrophages and the lymphocytes take over. So these are already there in the maternal blood, and as we can see, these also get transferred to the breast milk. So this becomes a form of innate immunity. So this innate immunity, or the immunity, the type of immunity which is being given to the child from the mother through the breast milk. So as we know, there are different antibodies and different cellular components like macrophages, and antibodies like, if we consider breast milk has antibodies like IgA, IgG, and IgM, right? So all these antibodies and the different macrophages and lymphocytes, they together contribute to the infection fighting phenomenon when the breast milk is given to the baby. So here, as we know that colostrum is the first milk, so can anybody tell me which antibody or which immunoglobulin is being transferred to the baby through the colostrum? I hope I am clear with the question.
B, B.
No, my
IgGM.
Okay, so yes, Shweta Sri, you are correct that the breast milk contains IgG, IgM, but yes, Soumya, IgA. So IgA is the correct answer. So if we consider the entire composition of breast milk, then IgG, IgM, IgA, all these antibodies are present. But if we consider colostrum, that is the first milk which is being given to the baby, and if we say what immunoglobulin or what antibody is being transferred to the baby specifically through colostrum, so then it is IgA. So IgA is the immune factor or the component which is giving it the innate immunity, right? Okay. Yes. So, as we have just studied about the protective effects of breastfeeding, so now uh, we know that breastfeeding is not only beneficial for the baby, but along with that, it is equally beneficial for the mother. So, if we talk about the different advantages or the different benefits that we have for the baby through breastfeeding, then we can see that breastfeeding is the ideal nutrition which is required for the growth and development of the baby, right? So we have discussed this in our previous sessions as well, that breastfeeding should be initiated within the first hour of birth. So what do we call this? When we initiate breastfeeding within the first hour of birth, what do we call this process? Can anybody volunteer and tell me the
Golden
answer?
hour.
Yes, the period of 1 hour is called golden hour, But what is this process of breastfeeding called? When we yes, breast crawl is also there, but this process of initiating the first breastfeeding is called, yeah, the
Early
answer,
initiate.
yes, initiation of breastfeeding. The answer is already there in my question. So, one is
Early.
initiation of breastfeeding that we do within the first hour of birth. Then we have the exclusive breastfeeding that we do within the 6 months of age, and then we have complementary feeding, right? So, it is very important to initiate this breastfeeding within the first hour of birth. Now, breast milk, as we have just discussed, that it also contains antibodies. So, the first milk which is being given, it contains antibodies IgA. So what IgA does, it prevents the tissue damage. So IgA, it gives a protection to all the mucus layers in our nose, in our skin, and so because of that, it gives us an ability to prevent the tissue damage. And it also protects the baby from different kinds of viral and bacterial infections. Now, it has been seen that exclusively breastfed infants, they have been found to be at a reduced risk of developing allergic diseases, say for suppose skin allergies or asthma, bowel diseases like Crohn's and ulcerative colitis, and also they have been found to be Miss Nishu Kumari, could you please mute yourself? Thank you. Yeah. So as we were saying, so the exclusively breastfed infants, they have been found to be less predisposed to all these diseases. So as we said, the allergic diseases, then bowel diseases, and third we have type 2 diabetes mellitus. As we know that type 2 diabetes mellitus is very common, but this has been seen that if a child has been properly breastfed or exclusively breastfed, then the incidences of type 2 diabetes mellitus is hugely reduced in cases of these individuals. And this also, the breastfeeding, it also makes these children less susceptible to different kinds of viral and bacterial infections, as we have just seen, and other kinds of ear infections, then respiratory infections, or any kind of gastrointestinal infections. And this enables the proper brain development and also the cognitive development of the child. So it has also been seen that if a child gets a proper breastfeeding period, then the child is found to have a higher and a better IQ and learning capabilities as well. So now we have seen the benefits of breastfeeding for the child. So next we will see the advantages of breastfeeding for the mother as well. So this
Uh,
breast,
Hi, sorry for disturbing.
yes, yes,
Yeah, I was actually trying to answer the questions and all. At that time, I just saw one of after seeing this portion. No, I'm actually doubtful about it. Like the question is like the role of immunoglobulin A antibodies present in colostrum.
right,
There are, most of the points I feel it's correct.
right.
Yeah, so it's kind of confusing.
So what is your exact question, if you could just tell me?
See, basically, what is the role of immunoglobulin A antibodies present in colostrum? It acts as a food for good bacteria. It binds germs, prevents. It also helps in passing the first tools. So everything seems to be correct
Okay,
here.
so here
Yeah.
again,
So
if
now,
you,
actually, I was actually, based on what I've seen, I was actually thinking something else. Now, after seeing this presentation, no, I'm slightly confused. Could you please help on this?
yeah, can you please clarify as to what you are confused? If you could just copy paste the question and the options also.
The assignment test, no?
Yes.
Yeah, the assignment test, question number 4.
Okay, can you just read it out?
1 minute, I'm just copy pasting it in
Okay,
the chat
okay.
box.
Yeah, that would be helpful, right?
Yeah, I just pasted it.
Yeah, yeah. So, what is the role of immunoglobulin A antibodies present in colostrum? So, it acts as a food for good bacteria. It binds to the germs and prevents them from entering baby's blood. It helps the baby in passing the first stool, and it promotes the growth of new blood vessels. Okay. So here, whenever we talk about immunoglobulins, so immunoglobulins are basically antibodies. So they are reacting, or they are acting with any antigen or any pathogen or unwanted germ which is entering into the body, right? That is the basic concept of immunoglobulin. So definitely, if you considered these options, they might seem correct for colostrum, but they have specifically said immunoglobulin A. So immunoglobulin A antibodies. So your answer should be it binds to the germs and prevents them from entering the baby's blood, right?
Okay. So
Yeah.
thank God I was right
Yes.
then.
So it acts as a food for good bacteria. Yes, that is there, but it is not the role of IgA. Then it helps the baby in passing the first stool. Yes, that is also I mean, a role of colostrum, but not of IgA. So if you read it correctly, they are asking the role of IgA, right? So the answer is
Okay.
option 2.
Okay. Okay. Yeah. Thank you.
Okay.
Thank you so much.
Yeah. So, next we would move on to the benefits of breastfeeding for mother. So, after seeing the benefits of breastfeeding for the child, we equally need to be very much informed as to what breastfeeding can do to the mother. So, first, helps to lose weight. So, breastfeeding it burns calories and helps to shed extra kilos gained during pregnancy. Okay, that is there. But apart from that, the more significant points are it promotes uterine contractions and thereby reducing the blood loss after birth. And it also helps to bring the uterus back to the pre pregnancy size. Apart yeah. So apart from that, breastfeeding it expedites the emotional bonding with the child while nursing. And because of this, many of us we already know that after delivery or after parturition, um, phase of depression exists for the mother which is called as postpartum depression. So this is not at all desirable for the mother. So this breastfeeding it also reduces the risk of postpartum depression in cases of mothers. So there has been other evidences where they say that breastfeeding reduces the risk of cancers like breast cancer and ovarian cancer, and it also reduces the predisposition of different diseases like high hypertension, then high cholesterol, cardiovascular diseases, and also diabetes. And also, um, for the mother, the entire premise of breastfeeding it helps the mother to maintain birth spacing. So can anybody volunteer to I mean can anybody volunteer and tell me what is birth spacing?
The gap between one pregnancy to another pregnancy.
Yes, the gap between one pregnancy to another pregnancy, and ideally it should be between 18 months to 24 months. So all these information, many a times what happens, the mothers they do not know these informations. So it is very imperative um, that we educate them, that we make them informed about all these information related to the advantages of breastfeeding, and also why birth spacing is also required for them, both physically and mentally, right? So next, protective factors in breast milk. So can anybody tell me the answer? What are the protective factors in breast milk? We have the options antibodies, bifidus factors, lactoferrin, enzymes, all
All
of
of
these.
these.
Yes. So, correct. So, all of these is the answer. So, if we, sorry. So, if we consider our options, we have antibodies. So, we have just talked about the different kinds of antibodies which are present in the breast milk, right? IgG, IgA, IgM. Now comes to the bifidus factors. Would anybody like to tell me what is a bifidus factor? Anybody? Bifidus factor. Okay. So let us first know about bifidus factors. So we have a microorganism which is a bacteria which is called bifidobacterium, right? So these are basically the lactobacillus bifidus bacteria. So they are good bacteria for the child. They are commensal bacteria. So these bifidus factors, what do? So they the breast milk harbors the bifidus bacteria, the bifidus factors, and when these bifidus factors are transferred to the child's body through the breast milk, so in the child's body they help in the growth of these good bacteria, that is the lactobacillus bifidus. So when these good bacteria grow, so they help in the prevention of growth of another bacteria which is called E. coli. So Escherichia coli is a pathogenic bacteria which can cause stomach problems or GI disorders or intestinal disorders in the child, right? So bifidus factors, through helping the bacteria lactobacillus bifidus grow, it is helping the child and it is giving a protection to the child from getting stomach or GI problems. Okay, so third is lactoferrin. Lactoferrin, it is an iron containing protein. So this is also present in the breast milk, and what lactoferrin does, it also gives a protection to the GI system in the child. So, as we know that a newborn child is very much predisposed to having stomach problems and intestinal problems, right? So, bifidus factors, lactoferrin, all these they help in giving protection to the child so that they don't develop these GI problems or gastrointestinal problems very easily. So, coming to the next option, we have enzymes. So, what do these enzymes do? So enzymes like lysozymes, amylases, lipases, so these when present in the body, they give they make they make the milk for the child more digestible. So the baby has just come out from the amniotic sac and is just out of the body. So it gives it a proper environment to digest. Yeah. So the enzymes are enabling the newborn baby to digest the milk that is being given to the child, the breast milk which is being given to the child. And it also gives it protection. It also gives it protection through these lysozymes, right? So if we consider the protective factors, all of these are very important protective factors that are present in the breast milk. So, if you have gone through the recorded lectures, you must have seen the image where it is beautifully written what are the different components of the breast milk. So, please go through that, and please go through all the different factors which are present, not only the protective factors but also what are the different nutritive factors which are present in the breast milk for the proper growth and development of the baby. So, yes, so the answer is all of these. Next question is, how much protein is present in 100 ml of human milk? Anybody would like to give the answer? How much protein is present in 100 ml of human milk?
It is B.
Okay. Anybody else? Okay. Kartik
It's the
Kumar.
fourth one.
Yes, sorry.
It's a 1.1 grams.
Yes. So the answer to this question is, as Kartik, Hitashi, and Varsha have very rightly said, it is 1.1 grams. So as we know that human milk is the most advantageous for a child, but why? So if we go into the composition characteristics of the human milk and the different substitutes which are present, we can see that human milk, it contains 1 to 1 grams of protein, right? In 100 ml of human milk, it is around 1 to 1 1.1 grams. Cow milk, it has got 3.2 grams of proteins, And buffalo milk, it has got the highest among all these three, which is around 4.3 grams. So if we consider the protein composition of human milk and cow's milk, we can see that the human milk has got a 60 percentage content of whey and 40% content of casein, and cow's milk has got a 20%, excuse me, so cow's milk has got 20% content of whey and casein about 80%. So as we know, casein is a protein which is present in milk, but human body finds it very difficult to digest casein. So now if we give cow's milk to a child, so as we can see, there is almost 80% of casein in the cow's milk. So giving cow's milk to a newborn child might it will definitely bring about digestion issues. So because of that, since the casein content is so much high in cow's milk, it is advocated that the child must be given human milk. If at all human milk is not being possible to be given, and it has to be substitute with animal sources, right? So the answer is 1.1 grams protein is present in human milk. So for the exam point of view, I would also like you people to go through the different composition, I mean the composition of different components, as in carbohydrates, fats, and how much of each is present in human milk, cow milk, and buffalo milk, and what kind of different macronutrients and micronutrients, how much of them are present in each source of these milk, in human milk and also the other milk substitutes. So we will go on to the next question. Which type of nutrient deficiency in mother will influence deficiency in breast milk? So as we had already discussed in our previous sessions, that there are two type of nutrients. So type 1 nutrients, these are the nutritional the functional nutrients, right? So these functional nutrients, they are catering to the overall function and the overall function of the different metabolic systems of the body. And type 2 is the growth nutrient. So these are related to the specific growth and development of the child. So if we now say that some nutrient is deficient in the mother, then which type of nutrient deficiency will be found to reflect in the breast milk? So can anybody? Okay.
It's type 1.
Okay, so some of you are saying type 1, some of you are saying type 2. So let us look for the answer. So the answer is type 1. So whenever we consider these nutritional deficiencies which will be carried on to the breast milk, so these are the type 1 or the functional nutrients, right? So for example, the most common group of functional nutrients which are usually deficient and that passes to the best through the breast milk are the vitamins. So these are the macronutrients, these are the micronutrients which are being transferred to the breast milk. So for suppose if we have a mother who is not being able to take the adequate amount of vitamin, the different vitamins that are required for her well-being, say for suppose vitamin B12, in case of vegan mothers, somebody is not taking proper diet, then vitamin B12 can be deficient. And vitamin K, so if vitamin K is not being taken properly, and vitamin D also, as we know, vitamin D, if vitamin the adequate requirement of the vitamin D is not being taken, or proper vitamin D is not being synthesized in the body of a mother, then because of all these deficiencies can also be reflected in the child. So it is very important that this situation needs to be controlled by supplementation of these specific vitamins. So if the mother has got these vitamin deficiencies, then it will definitely be reflected in the breast milk and it will be passed on to the child. So to avoid that, we should also be motivating the mother to get the proper kind of nutrition through her food and also through supplementations. And also, safe side, the child should also be given the proper supplementation of these vitamins. And if we consider about the type 2 nutrients, which are the growth nutrients, so it has been seen that the micronutrients or the different types of type 2 nutrients, they usually do not cause a very significant kind of an effect on the breast milk even if the mother is deficient. So the answer to this question is type 1 nutrient deficiency. Okay. So next we move on to question number 6. So question number 6 is neonates necrotizing enterocolitis is a serious condition caused due to inflammation and damage in the, so the four options are liver, intestine, kidney and lungs. Yes,
Intestine.
intestine, correct.
B, intestine.
Yes. So somebody is saying liver, but liver is not the correct answer. The correct answer is intestine. So whenever I know, yeah. So I know a lot of you might be finding a bit difficulty related to terminologies. So whenever we get some terminology which we are not able to understand, so please try to uh, look through the terminology and try to analyze it so that you get to understand the meaning of it, right? So if we consider the terminology which is being given here, necrotizing enterocolitis, okay? So necrotizing, we know necrosis, the word necrosis, it means death, cellular death or tissue death, right? So this has to be related to something which is causing tissue death. Now let us come to the second term, enterocolitis. So entero, colo, these are very common terms which are being used for intestine. So whenever we consider the medical terms which are being used for the different parts of the body, entero is being used for small intestine and colo is being used for large intestine. And now we have the term itis. So itis, whenever you see itis anywhere, that means inflammation. So itis related to any part of the body is that inflammation in that part of the body, right? So, if we consider necrotizing enterocolitis, so this is a condition in which there is severe inflammation and cellular or tissue damage or tissue death in the intestine of the neonates or the infants. So as we have seen, if the baby is not being breastfed properly or proper nutrition has not been given from the first from the first hour of after delivery, so these might make the baby predisposed to different kinds of GI diseases. So, among them, more complicated situation would be a necrotizing enterocolitis, and this is usually seen in premature babies and also in sick babies. So, if the immune system is not that much developed in the baby, say for suppose the baby is a low birth weight baby or a premature baby and doesn't have that proper immunity, or the innate immunity has not been properly transferred through the breast milk, so all these conditions can lead to severe complications like necrotizing enterocolitis, right? So the answer is intestine. Okay. So our next question is immediate skin to skin contact between mother and baby is recommended in. Immediate skin to skin contact between mother and baby is recommended in. Yes, somebody wants to
Gold
answer.
hour. First hour after birth. Gold hour.
Okay. So let us go through the options. So first we have something called gold hour, right? So if we recapitulate our lectures, uh, there is nothing called gold hour, but something called golden hour, right? Yes, a lot of people are answering A. So A is not the answer. If you go through the options, there is also an option the first.
First hour after birth.
Yes. So the first hour after birth. So please, whenever you're going through the MCQs, there are a lot of MCQs which might appear very easy, but please go through all the options before marking them, right? So the first hour after birth is called the golden hour, right? And in this golden hour, it is very, very, very important that the immediate skin to skin contact is given to the child and the mother, right? Okay. So, as we can see, this golden hour should be characterized by uninterrupted skin to skin contact. So, at least for 1 hour, there should be uninterrupted skin to skin contact, or commonly known as STS, in between the child and the mother, right? So this will initiate, and it yes, anybody is saying something? um, Go green. Would you like to say something? Are you saying something?
No, ma'am, sorry, by mistake.
Okay, okay, yeah, okay. So
1 minute, I had a doubt, ma'am.
yes,
Uh,
yes, please go
is
ahead.
it okay to give 1 hour of skin to skin continuously to the baby after birth?
Yes, so that is the ideal time which is advocated, that at least for the first 60 minutes or the first hour, they should have an uninterrupted skin to skin contact. So that is the advocated norm which is being followed, right?
Okay, because usually they are only giving like 20 minutes, 30 minutes, and they say that itself is too high. So that is why for me this was okay.
Okay.
Thanks for the
So
information.
that is what is usually advocated. So maybe if there are other informations, I can always update you later.
Thank you.
Okay. So now, what is the importance of this skin to skin contact? So, as we know, this will expedite the bonding between the newly born child and the mother, right? And this also helps in the release of a hormone which is called oxytocin. So, this oxytocin, okay, so before moving on, can anybody tell me which is the hormone which is responsible for the formation of milk? If we consider two hormones which are making milk and then releasing milk, so which is the hormone which is helping in the formation of breast milk?
Oxytocin.
Okay, any more answers? Yeah. So, please do not get confused. These are two very major hormones, prolactin and oxytocin. So, prolactin is the hormone which is helping in the formation of the milk, right? And oxytocin, which is also called the love hormone, and it has got a lot of other names. So, oxytocin is the major hormone which is making the release of milk possible. So, if you have, I am sure you have gone through the lectures. So, there you must have already seen that there is an image of a mother holding the child, and when the child it initiates its suckling, so that also initiates another reflex which directly sends the signals to the mother's brain. So then these signals, they tell the mother's brain tells to the muscles of the mother's body that okay, now we need to secrete oxytocin. So this oxytocin, when it gets secreted, so this oxytocin now leads to the release of milk from the breast. So then that milk is being fed to the child. So prolactin is for the formation of the milk, and oxytocin is the hormone which is helping, or which is influencing the release of the milk, right? So this let us go back. So this uninterrupted skin to skin contact, it is also resulting in the release of oxytocin. So this is an entire cycle, a very desirable cycle. So if this uninterrupted skin to skin contact, it is increasing the release of oxytocin, so then more amount of milk will also be available for the baby, right? And the breastfeeding phenomenon which will be easily executed. So this golden hour, it also fosters the maternal behavior, And of course, the most important factor which needs to be remembered and which needs to be informed to every mother is the initiation of breastfeeding. So it is very important that the first breastfeeding needs to be initiated within the first hour. So, as we can see, these major activities take place in the first hour after parturition or after delivery. So, hence, this is the golden hour. So, hence, this is a very important, yeah, so this is a very important time which needs to be kept in mind. The first hour after birth, breastfeeding needs to be initiated. Proper skin to skin contact should be there, which will obviously lead to an entire desirable cycle of the baby's breastfeeding phenomenon, right? Okay. So next, feeding colostrum also helps in passage of. Anybody would like to give me the answer?
Meconium. Meconium.
Yes. And what is meconium?
Forming.
The first black stool.
Okay. Yeah. So as we can see the options, um, first option atrium doesn't make sense, so forget. Foremilk, hindmilk, meconium, right? So as we have just studied, since one of you have given the answer foremilk, so we should be very clear and there is nothing to be confused here. The question reads colostrum, right? So colostrum is the first milk. And we have just studied that there are three phases: colostrum, transitional milk, and mature milk. And mature milk has got two stages: the fore milk and the hind milk. So obviously these three options they get eliminated from our answer. So atrium, fore milk, hind milk are not our answers. Even if somebody doesn't know what is meconium, still you can figure out what is the answer. So if we can see meconium, as Mr. Vasi Reddy has very rightly pointed out, it is the first stool of the infant, right? So this stool, it gets formed when the baby is already inside the womb, that is during its life in the uterus. And when this baby comes out, so the first stool which happens, it is black and dark green in color, right? So why do you think it is dark green in color? Anybody? Why do you think this tool is dark green in color?
It has got more bilirubin into that one.
Yes, the answer is already on the slide. So it has got, okay, so diet junction, it is not because of iron and supplements, it is mostly because of bilirubin, right? So bilirubin is a pigment which gives it its characteristic dark green or black tarry color, right? So this meconium, it usually passes in between the 24 to 48 hours of birth. And also sometimes what happens, if babies are not able to, yeah, so if babies are not able to pass this meconium, so this can also lead to neonatal jaundice, right? So we must have also heard that neonatal jaundice or jaundice in newborn babies is a very common occurrence. So to prevent this, colostrum feeding needs to be done methodically, right? So this colostrum feeding will lead to the passage of meconium, and this will also prevent the neonatal jaundice as it is flushing out the bilirubin. Many a times, what happens, the newborn babies they tend to aspirate or they tend to swallow this meconium. So, this leads to a syndrome called meconium aspiration syndrome, where they have a tendency of taking in the contents, the taking in the meconium and also the amniotic fluid. So this is a complication which happens if it happens after immediately after the delivery. So as I've just said, it's called a meconium aspiration syndrome. So if anybody is interested, you can just go through the different sources which are available online also. And yeah, so the answer to this question, feeding colostrum, apart from the nutritional value of colostrum, we can see that colostrum is also helping it to um, pass the first stool, right? So, yeah. So, in the question before, Varsha Satyan had said there was also one option, it helps the baby in passing the first stool, right? So, as I have just discussed, these are all functions of colostrum. So, meconium is the answer. Okay. Let us go to the next question. Where should the baby be kept in a maternity home? Where do you think a baby should be kept in a maternity home?
With the
With the
mother.
mother.
Same attachment.
Yes, definitely with the mother. So we do not, after going through so many specific topics related to the importance of breastfeeding, skin to skin contact. So the most important thing is the baby should be kept with the mother, right? So as we can see, the proximity with the mother, we have just learned about the benefits of the skin to skin contact. So these skin to skin contact or keeping the baby with the mother, they have huge benefits. So these benefits, they will obviously they include say for example feeding, the demand for feeding. The mother can easily identify when the child is hungry or when the child needs more of the breast milk. So and then the baby obviously will be in a comfortable environment, right? Then if the baby is with the mother, so there are lesser chances of infection for the baby. And also it as we have just discussed about the reflex which is working in the mother. So if the baby is there, so then it directly passes on it passes on a signal to the mother's brain, which then allows the milk to release. So and also definitely it creates a very strong emotional bond between the mother and the baby, right? So these are very 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 important advantages of skin to skin contact or proximity between the mother and the child. So, in general, we need to remember that a newborn child should always be kept with the mother. Okay, so now we move on to the next question. How to recognize that mother's milk is sufficient for the baby after 15 days? So,
Urine output.
yes, urine output and weight. So, can anybody tell me how will we like quantify how much should be the urine output or how much should be the weight? How do we say that okay, the amount has been sufficient for the baby? How do we say that?
The baby should wet the nappy at least 7 to 8 times in a day.
Yes,
And the baby should be able to gain half a kg of weight,
half a kg of weight in.
15 days.
Okay, so let us see the answer. So, as we can see, the Ministry of Health and Family Welfare, it says that if the baby urinates for around 6 to 8 times in a day, and if his or her weight it increases by 500 gram every month. Please remember the weight increase is in month. So if a child has been found to micturate 6 to 8 times in a day, and also if the weight gain is around 500 grams in a month, then we can say that okay, the breast milk which is being fed to the baby is sufficient for the baby's growth, right? And also, can anybody tell me what should be the frequency of feeding to the child? How many times should we usually feed the child?
On demand.
Okay, on demand, yes.
10 to 12
10 to
times.
12.
Yes.
After 2
So
hours.
initially it is around 10 to 12 times a day over the entire day, which is usually the advocated timeline for the feeding of milk to the child, right? So please keep in mind the parameters which are being taken into account regarding the urinary output and the weight increase which will confirm that okay, the milk which is being fed to the yeah, the milk which is being fed to the baby is sufficient. Yes, somebody, Gayatri. Yes, you have a question? You have raised a hand. Do you have a question? Okay, we'll get back to it later again. So, yeah, so the answer is urine output and weight. Okay, so next, let us see what is not a proper method of baby suckling at the breast. What is not a proper method of baby suckling at the breast? Anybody would like to answer this? So the question asks about the method which is not proper for breastfeeding.
The black part around the nipple is out of the child's mouth and the child is sucking only nipple.
Right. So this is the correct answer. So this is what we are talking about is the improper latching. So as we can see that whenever we are considering the proper method for breastfeeding, we have to make sure that the maximum area of the nipple and also the areolar part. So for yeah, so the areolar part or the black part of the breast around the nipple, it should be into the child's mouth. So the nipple and also the areolar area. Okay. And next, the child's chin should be touching the breast. So if we consider the child's chin, it should be touching the mother's breast. And third, the child should have a proper skin to skin contact, right? So whenever we are considering the correct method of breastfeeding, so number 1, uh, the it should be the nipple and also the areolar part which should be inside the child's mouth. It shouldn't be just nipple, or it shouldn't be nipple feeding. In case it is just nipple feeding, then it leads to an incorrect method of breastfeeding, right? Second, the child's chin should be touching the breast. Okay, and it should have a proper skin to skin contact. So if all these three parameters are maintained, then we can see that more milk is produced, and subsequently the child will be getting the proper amount of milk that is required. And also there will be no discomfort in case of in for the mother. So the mother won't feel any kind of discomfort or any kind of pain around the nipple. So now if we go to the incorrect method, so if we see that there is incorrect latching or there is just nipple feeding, so that might also not ensure the proper milk reaching the child, right? So the breast milk might not be properly reaching the child's mouth, and it can be wasted, and also this might cause pain and discomfort for the mother. So it is very important that the proper breastfeeding technique be employed, and also everybody should be informed about the correct method of breastfeeding. So please remember these three parameters as to how much of it should be within the child's mouth. There should be skin to skin contact, and also the position of the chin. Okay, so we go on to our next question. Breast crawl is not indicated for. So what is the answer?
Large, unstable baby
Unstable
with low
baby,
birth weight.
low blood weight.
D. 4.
Right. So the answer to this question is unstable babies with low birth weight. So as we have we have discussed in our previous session also, that breast crawl is a very instinctive movement by the child towards the breast of the mother for the subsequent breastfeeding, right? So, breast crawl is possible by full term stable babies. It is possible, it is not a contraindication in case of any natural or cesarean section babies. And also, crawl can be easily done by babies who have cried immediately after birth, right? But in case we tend to make the unstable babies with low birth weight do a breast crawl, that might lead to respiratory distress, right? So any kind of respiratory problem will not be beneficial for the child, right? So these unstable babies with low birth weight, they are not capable of doing breast crawl. Now, whenever the child is doing this breast crawl, so this phenomenon should ensure three things. So number one, there should be a contact, a tummy to tummy contact, that the tummy of the child should be in contact with the mother's tummy. So a tummy to tummy contact. Number two is the child's head should be in between the mother's unwashed breasts, right? So the head should be in a position in between the mother's breast. And number three, the child's mouth should be below the mother's breast. So, whenever we are considering the proper position of a child in case of breast crawl, so number one is the tummy to tummy contact. Number two, the head should be in between the two breasts of the mother. And number three, the mouth should be below the mother's breast. Okay. And
Ma'am,
yes,
sorry. Uh, I have a little doubt on this. The
yes,
second point, no,
yes,
the head in between mother's unwashed breast. So
yes.
why the unwashed breast?
Yeah.
So why
So
not washed breast?
yeah, so unwashed breast is to maintain the environment because it is just immediately after the birth of the baby where it is being followed by breast crawl, right? So to avoid any kind of infection or to avoid any kind of inadvertent followings, it is said that unwashed breast. So it is the same environment as to where the child delivery has just happened, and there shouldn't be any break. So since after delivery only the breast crawl is following and then it leads to the breastfeeding, so within that usual series, hence it's written as unwashed breast. So there is no other chances of any kind of infection.
Okay, ma'am. Thank you.
Yeah. So this breast crawl, it also like as we know, this breast crawl is obviously the instinctive movement from the child's side, right? So the child knows that okay, my mother is here and I need to go to my mother's breast and I need to do the breastfeeding. So that is an instinctive movement from the child's side. But this also is advantageous for the mother. So as we have also discussed the advantages of breastfeeding for the mother, so this through breast crawl and culminating in breastfeeding, this also helps in the faster expulsion of placenta through uterine contraction in case of the mothers. So this also reduces the blood loss for the mothers, and hence there will be lesser chances of anemia in cases of mothers. So hence the breast crawl leading to the breastfeeding, um, it is a very beneficial phenomenon which is occurring after child delivery for both the child, obviously directly, and it also has the indirect advantages for the mother. Okay. So next, how many natural stages or behaviors does the baby have after birth?
Nine.
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 Yes, correct. So if we consider the natural stages, excuse me, if we consider the natural or the instinctive behaviors of the child immediately after birth, then there are specifically 9 stages. So as we can see, The first stage is the crying of the baby immediately after the birth, right? So, this is followed by a second stage where the baby is relaxing. So, the second stage is of relaxation where the baby is kind of still and there is not much movement. Okay, so this is followed by the third stage, which is the awakening. So, after a period of dormancy, now the baby awakes. So, the baby gently opens his or her eyes, and there are very subtle movements, right? So, then this is followed by number four or stage four, which is activity. So, in stage 4, the child now has got more pronounced activities related to the wide opening of eyes, then wide opening of mouth, and movement of hands, fingers in stage 4. So, then in stage 5, this is again followed by a stage of resting. So, the baby has now figured out okay, this is the place where I had to come and where I had to stay, so now I will rest for some time. So then this stage 5 is the resting phase again for the baby. So then in stage 6, now the baby crawls. So the baby crawls to the proper breastfeeding position, and then in stage 7 we have the familiarization. So the baby has now different movements, which the movements in between the baby's fingers and the mother's nipple. So this is also related to the opening of the mouth of the baby, and this is how the baby is slowly familiarizing with the entire environment. Now this is followed by the suckling. So the baby now sucks on the mother's nipple, and the breastfeeding process is initiated. And after this, the baby then sleeps, and this is the stage 9. So, as we can see, through every stage, we have a specific activity profile of the baby, which are being specifically mentioned in each uh, phase. So, these are all instinctive or natural behaviors of the baby, right? So, this
Ma'am,
is, yes,
sorry.
yes,
Ma'am,
yes.
the initiation of breastfeeding is, comes under also this breast crawl also is a part of the initiation of the
Yes, yes.
breastfeeding.
The breast crawl would be, see, here the breast crawl phenomenon is also a part of this entire process, right? So, say for example, in the stage 5, the child is resting. So now the child uh, crawls and comes to the proper position. So the entire process of breast crawl also comes under all these behaviors of the child. Have I?
So the initiation of breastfeeding is the breast crawl is a part of the initiation of the breastfeeding. No, is it okay? Or
Yes, yes. Breast crawl as a process, it is the initiation of the breastfeeding, the entire process, right? So,
okay, ma'am.
so it's the process, as in if we consider breastfeeding, not the moment from which the breastfeeding is taking place, like not the suckling which is taking place, but the entire breastfeeding process. So obviously, after the delivery, the baby has to be kept in such a position so that the baby is able to do the breast crawling, and then this will culminate into the breastfeeding.
Okay, ma'am. Thank you. Thank you so much.
So we have all these 9 stages after the birth, and again, this is very, very important, and it has to be established every time that 1 hour of uninterrupted skin to skin contact post delivery is very important, right? And this has also been seen that all these 9 stages of the natural behaviors of the child that we have just gone through, so these usually stay for the first 4 to 6 months after birth. So after every cycle of all these natural behaviors, say for suppose a child has already had his or her milk, and then the child sleeps, and then again the cycle continues. So this instinctive behavior, it has been seen to be persistent for the first 4 to 6 months of age, and then 4 to 6 months of age. So, yes, the answer to this question is option A, or 9 stages. Okay. So the next question is, when was the infant milk substitutes, feeding bottles, and infant foods IMS amended? Answer, please. I'm sure all of you already know the answer. Am I audible?
2003.
Yes, 2003. So we have to remember that this act, infant milk substitutes, feeding bottles, and infant foods, this act was initially um, this act was made initially in 1992, and then the amendment was done in 2003. So please remember these timelines related to the acts. So answer is 2003. Now, if we consider the act specifically, so the IMS Act, it is considered violated if a food is promoted by any means, specifically for child up to how many years of age?
2.
2. Correct. So the answer is 2. So if we go through the legal perspectives of this act, so it has shown that the IMS Act has banned any kind of promotion of infant formula. So, as we have just seen, that any kind of milk substitutes or any kind of infant formulas, then feeding bottles and infant foods, other kinds of food, they have been banned from 0 to 2 years of they have been banned for children of 0 to 2 years of age, right? So let us go back to our first session. We have already studied that when the child is born, so for the first so for the first hour, it is the initial breastfeeding. So I hope all of you remember this and it is not to be forgotten. Uh, and then for the next 6 months, till the 6 months, it is exclusive breastfeeding. So the child needs to be given the child needs to be breastfed, right? And then from 6 months of age to the 2 months of age, it needs to be given more whatever nutritional requirement is required along with breast milk. So this is the complementary feeding. So as we will go, we can see that whatever normal food the whatever normal food even adults are given, so specific amounts of those foods in specific in modifying those specific foods also, these can be given to the child. So along with breast milk, for proper nutrition maintenance, these complementary foods also need to be given. Now there are companies who advocate these infant formulas, then these milk substitutes, and say that okay, they have the specific nutrition which is required. They say that they have the omega 3, say EPA or DHA. We have discussed about these in our last session. So they have not been found, and even say for suppose in the fortified milk or the milk substitutes, they have been found to be deficient in specific kind of vitamins. So if we give these kind of milk formulas or milk substitutes or other kind of infant foods to children below the age of 2 years, then the proper cycle of their nutrition will not be maintained. So to maintain that exact cycle of breastfeeding and breastfeeding along with complementary feeding, so the IMS Act has banned any kind of these kinds of and have banned these kinds of formula feed or other substitutes for children less than 2 years of age, right? Okay. Next question, the expressed breast milk can be kept in room temperature before feeding for how much time? So after the mother expresses the breast milk, and in case it cannot be fed to the child at the same moment, but this milk can be kept at room temperature for how much time? Anybody would like to volunteer for the answer?
6 hours.
Anybody else? Okay, so let's go to the answer. Yes, the answer is 6 hours. So if we consider, let us see, if we consider freshly expressed or pumped milk, then if it is at room temperature, so at around 25 degrees centigrade, this can stay up to 4 hours. So as we can see, our options do not have 4 hours. Excuse me. So this can be safely said that okay, 6 hours is a safe time for which the expressed breast milk can be kept at room temperature, right? Now, this freshly expressed milk, if it is kept in the refrigerator at 4 degrees centigrade, then its validity is up to around 4 days. And if it is kept in the freezer, then it can be used up till 6 months. Somewhere it is also advocated that it can be kept till 12 months, but in case the entire nutritional efficacy of the milk needs to be taken, so then 6 months is the ideal time. Now, if we consider the previously frozen or thawed milk, so previously frozen or thawed milk can be kept for around 1 to 2 hours at room temperature. If it is kept at 4 degrees, then it is up to 1 day. And it is to be advocated that human milk, which has been frozen once and has been thawed once for use, it should never be refrozen. Okay, so if milk has been frozen once and then we take it out, we have thawed it for use, it should never be refrozen, right? And leftover from a feeding, so if there is a leftover from a feeding and the baby was not able to finish the entire bottle, then that milk should be used within the 2 hours of the 2 hours after the baby has finished the feeding. So please keep in mind the different time frames as to how the breast milk can be reused, because many a times what happens, we do not exactly have idea as to how or how much time this milk can be kept fresh, or after how much time this milk can be used, or after how much time the milk goes stale. So for example, many people have this notion that colostrum is stale milk, and many a times people do not have a clear idea regarding the storage of milk also. So please keep in mind these time frames. Okay, so we move on to our next question. What are the essential components of kangaroo mother care? I would like somebody um, to answer. What do you think are the essential components of kangaroo
Both
mother care?
A and C.
Yes?
Both A and C.
Okay. Anybody else?
A and C.
Okay.
A and C.
Right. So, the essential components of kangaroo mother care are A and C, that is skin to skin contact and exclusive breastfeeding. So, before moving on to the explanation of this question, I would like anybody of you who is not from a clinical background to um, let me know what is kangaroo mother care.
Having the baby on breast skin to skin contact.
Yes. Yes.
For premature baby. For premature baby.
Right. So, for premature babies or for low birth weight babies, whenever we are giving this specific skin to skin contact or exclusive breastfeeding to the baby, this is called the kangaroo mother care. So, let us see. So, if there are stable low birth weight infants or there are preterm or premature babies, so this is a very beautiful way of providing care to these kind of babies, which gives them a sustained and a prolonged period of skin to skin contact, right? And the beauty of this is that it is not only to be performed by the mother, but it can be performed by any individual, be it the father or be it any relative of the baby. So, this is a kangaroo mother care. it can be stopped once the baby attains a weight of 2.5 kgs. So it is usually, the indication is usually in the babies who are less than 2500 grams, that is 2.5 kgs. So once these babies they attain a decent weight of around 2.5 kgs, or they become or they reach the period of gestation of around 37 weeks, so at that point of time this kangaroo mother care can be terminated. So the essential components of kangaroo mother care are skin to skin contact and exclusive breastfeeding. Correct. So next is, when should skin to skin contact be started if the mother is COVID-19 infected?
Immediately after birth.
Yes.
3 days after.
Okay.
B
So
is the answer.
yes, Mr. Vasireddy.
B is the answer.
Okay. So Miss Gayatri, if you say it is 3 days after birth, why do you think it should be 3 days after birth?
That's a correct answer, ma'am.
No, like if you say it is 3 days after birth, what is the reason? Let us like see. I mean, what should be the answer? Why do you think it should be 3 days? Like, is there a reason, or have you read it somewhere? Okay, never mind. So yes, um, the answer to this question is immediately after birth, right? So please do not make this mistake. Even if a mother is COVID-19 infected, the mother can still start the skin to skin contact at the breast and the breastfeeding immediately after the birth. So there are few recommendations in US which says that HIV positive mothers cannot do breastfeeding, but now there are a lot of recommendations by the Ministry of Health and Family Welfare which says that even HIV positive mothers can still breastfeed their child, and hepatitis B and hepatitis C mothers can also breastfeed their child. The one absolute contraindication where the child cannot be breastfed is the classic galactosemia. So this galactosemia, it is a condition. So so obviously galacto means it is related to galactose, and emia, anything with emia is related to blood. So when we are saying galactosemia, so it is a condition where the galactose stays in the blood. So if an infant has this disease, so that it means that the infant's body is unable to metabolize the galactose, right? So if to such an infant we breastfeed, or to such an infant we give milk or dairy products, sorry, so the baby will not be, or the baby's body will not be able to break down this galactose, and it will start getting accumulated in the blood, and it will not be cleared out, and this will act as toxins for the baby's body. So because of this galactosemia is one condition which is an absolute contraindication for breastfeeding. But otherwise, it is advocated. Yes.
Ma'am, what is galacto?
Mm-hmm.
What is galacto?
Okay, galactose, right? Okay. So when we, um, you know about carbohydrates, right?
Yes.
Okay. Before telling you, can you just let me know your background so it's easier to um,
Right now I'm housewife.
Okay, okay. So we have studied about carbohydrates, proteins, and fats, right? So these carbohydrates we call sugars. And in carbohydrates, there are different kinds of sugars. And the most simple kind of sugar is glucose. So, like these, there are other kinds of more complex sugars if glucose and fructose bind, they form sucrose. So these are more complex sugars which needs to be broken down in the body by different enzymes. Contains lactose, and if the body needs to metabolize or absorb or break down these complex sugars into simple sugars, then it needs to have those metabolizing enzymes or those breakdown enzymes. But in children who do not have in children who have this disease, they are unable to break down those. So if your milk, say for suppose you are giving, as I've just said, if you give milk to a child with galactosemia, so your milk has got lactose and your milk has got galactose as well. So this will not get broken down into simple sugars, and if it is not broken down into simple sugars, then these sugars will not get absorbed in the body of the child, and as a consequence, it will stay in the blood of the child and behave as toxins. So anything which doesn't get absorbed or assimilated into the body, it is not beneficial for the body. So that will happen in this case as well. I hope I have been able to
Yes.
make it clear
Thank
for
you.
you.
Okay, ma'am.
Thank you.
Okay. Yeah.
Even in the last week, I think there was a change in the by the U.S. government with regard to the HIV positive women breastfeeding the babies. They have changed the norms.
Okay, okay. So I am not as far as I know that Ministry of Health and Family Welfare, they don't have any contraindication regarding HIV positive, but US government I need to check, and yeah. So if
Last
you
week I
have,
read it. Yeah, last week I read it in the
yeah.
newspapers. Yeah.
Okay, okay. So if you have come across it, so yeah, so then definitely from US government also it is not a contraindication for HIV mothers. Yeah. Okay,
So
thank you.
HIV patients are getting perinatal prophylaxis for children.
Yes,
There is
yes, ma'am.
absolutely zidovudine syrup is available and evaporin, which we routinely give to all the neonates who are HIV positive mothers. So the question of infection doesn't come.
Doesn't
So
arise.
should be
Yes.
given breastfeeding.
Yes. So, as Dr. Patil has very rightly said, since they are already being given their different retroviral regime and different medicines which are giving them the prophylaxis, so because of that, they are very. It is safe for even HIV positive mothers to give their breast milk to child. So, as we had the preconceived notion that no, breast milk cannot be given to the children, so of course that can be negated. So yes, thank you, Dr. Patil and Mr. Vasireddy. Thank you for the information. So we will move on to our next question. So mother complains about reduced breast milk supply. What could be a possible reason among the following? We have discussed about this, so anybody please volunteer. Reduced breast milk supply, what could be a possible reason?
Nipple reading, feeding.
Yes, correct. Yeah, nipple feeding, correct. So we have discussed improper latching, it leads to nipple feeding. And if we consider, we have just discussed about the different positions or the different parameters that needs to be kept in mind when we are considering the proper breastfeeding technique and the improper breastfeeding technique. So as we can see that if we need to have or if we have to have a proper latching of the child's mouth with the breast, so we can see that the lips should be turned outward. So the lips are turned outward and the mouth should be wide open, and as we have discussed previously also, the chin should be touching the breast. And if it's an improper feeding position where there is poor latching, so obviously the lips are turned in, then the mouth will be around the nipple, so that is nipple feeding. It shouldn't be that, right? And the chin is not touching the breast, so these are not desired. So if we go through our options, we can see that lips turned outward, obviously it is a proper method. Mouth should be wide open, not using a nipple shield, and nipple feeding, right? So nipple feeding is the correct answer. Okay, so to our last question for today's session. In any breastfeeding hold, the mother's fingers holding the breast should be in which direction? In any breastfeeding hold, the mother's fingers holding the breast should be in which direction? Anybody?
First bullet.
Parallel to the baby lips.
Yes, parallel to the baby's lips. So, yeah. So, as we know that there are different positions in which the mother can hold the baby. So, we know there is a cradle hold, there's a, okay, somebody else. Yeah. So, as we know, there is a cradle hold, there is a cross cradle hold, there is a rugby or a football hold, and there is a side lying posture or a position, right? So, these are different kind of positions in which the breastfeeding can be done by the mother. And the during the breastfeeding, the mother's fingers should be holding the breast in a position so that the uh, the the breast the fingers on the breast, it is exactly parallel to the baby's lips, so it will ensure a proper latching of the baby's mouth to the breast, and that will subsequently lead to proper breastfeeding. So we have just discussed very superficially about the breastfeeding techniques and the different positions as to how the position of the mother and the child should be. So you people will be I mean you should be getting to know this in the week 6, and it will specifically will be based on the different positions of the mother and the child and how everything should be placed so that the proper breastfeeding technique can be employed. So we will talk about the breastfeeding techniques again in the next session. And as for today's session, this was the last question, the last problem for today's session. So if you have any queries or any other suggestions, um, please feel free to put that forward. Anybody?
You see, ma'am,
Yes.
with watching.
You are not audible. Could you please write down in the chat box if possible?
Okay, yeah, yeah, sure.
Okay. Yeah, I hope. Yeah, one more thing that I just wanted to remind you people. So, all these sessions, the recorded sessions, they have been uploaded like every day when we are taking the sessions, it is I mean, it is simultaneously being uploaded onto YouTube. So, by now, I think you must have already received an email from the NPTEL team. So, if you go to the mail and if you go to your course dashboard, so in problem solving sessions, there is a click here command which is given. So if you go to that click here, you will be opening an Excel sheet, and there you can find all the lectures, the recorded versions of all the sessions which have been taken by both the PMRF TAs. So in case of any doubts or in case of any problem, you can just go back and have a look at them. I hope you people have received the mail, right? Can anybody
Yes,
confirm?
ma'am.
Yeah, we have
Received.
received. We have got the mail.
Yes, ma'am.
Okay.
Received.
Okay. So you can go back to those recorded lectures, and also if you want the slides that we are presenting, so just beside the recorded lectures there is a drive link where you will find all the slides. Say for example, just beside my name there will be a drive link. So if you click on that, so you will be able to access all these presentations that we are showing you during these sessions.